President Trump is close to signing this executive order on Obamacare, and that order, I'm told, will likely come tomorrow. So what are association health plans, and how would they help you? Dr. Marc Siegel, professor of medicine at NYU Langone Medical Center and a Fox News contributor. And Mark, good morning to you.
Morning, Bill.
What are these plans?
These plans, trade association plans, and we're talking about 92,000 trade associations in the United States. The oldest trade association is the American Medical Association, which dates before the Civil War, Bill. And there's everything from library associations to churches to American Diabetes Association. And you might pause and say, wait a minute, maybe the American Diabetes Association might know how to insure diabetics, right? The American Cancer Society, you know, your local state and federal agencies. The key here is that President Trump is going to sign an order where they can go across state lines. So let's say you're an author and you can't afford your insurance. You go to the Writers Guild. They'll provide you with a catastrophic or a minimal insurance, something to cover you in case of an emergency. Or maybe something more dialed up than that, Bill, but not necessarily something that covers everything from soup to nuts. Maybe it won't cover 10 essential benefits. Maybe it won't cover all pre-existing conditions. But you know why I like it? Because 6.5 million people already take the penalty, and half of them are under the age of 35. They say, wait a minute, I'm going to wait till I get sick. I don't want this Obamacare. I'm going to wait till I get sick. And Aetna dropped out of most of the exchanges last year, citing that. They said 55% of our new signees are already sick.
So if you're a writer in California or a writer in California or New York or Illinois, you could join that group, essentially, is what
you bet. And if you work for a small business, or you are unemployed, or you're self-employed mainly, instead of going to a state exchange where they're offering a one-size-fits-all product with a premium, like, let's say, in Alaska, Kellyanne Conway said in Alaska, the premiums have doubled since 2013. In Arizona, they've doubled since 2013. Deductibles are up to $6,000, $7,000 a year. Instead of dealing with a product you can't afford, you're a young person starting out in life. Now you'll be able to say, what about that association I belong to? What about my church? What about my synagogue?
Sounds a little more tailor-made. On screen for our viewers, just to spell it out for you. Individual small businesses could join large group insurance market.
Exactly.
Could be formed by trade groups, as you mentioned. Professional organizations or community groups would expand options for consumers, possibly lower costs. Take that last point.
Well, so
will it lower the price?
That's where the argument is. That's where the debate is. I think it will, and I'll tell you why. Because if you take somebody that was going to take the tax penalty and now has an option of buying a cheap insurance bill that covers emergencies, they're going to take it. They're going to buy into it. So those 6.5 million people are now going to want to be insured, but they're going to buy cheaper insurance. So that will actually bring premiums down. Now, for the remaining in the group, here's the counter-argument.
Yeah.
For those who remain on the exchange, they'll say, well, wait a minute, their premiums are going to go up because they're all sick, because they have pre-existing conditions, because they have chronic illnesses. The problem is that's already happening. It's already happening, and that's where the government has to come in and subsidize those who are most ill. You can end up with a two-tiered insurance, but the tier of the people who are most sick can be subsidized by the government.
Last point. Yesterday, the president said this about the potential executive order from the White House. Watch.
We'll also be signing something probably this week, which is going to go a long way to take care of many of the people that have been so badly hurt on health care. And they'll be able to buy, they'll be able to cross state lines, and they will get great competitive health care, and it will cost the United States nothing. Take care of a big percentage of the people we're talking about, too.
He is not happy with the failure of repeal and replace. Is this the best he can do to chip away at it?
This is the best he can do right now. He doesn't like the mandates. I don't like the mandates. I don't want to force people to buy a product that doesn't work in my office. Those stay. So here's a way around them. Let's offer a different way of providing a product. And by the way, in case you consider this revolutionary, Bill, this was being jockeyed around under the Bush administration. This is not new. This is something that almost passed in 2005. And I think it's wise because people don't need all of this insurance. Many people that are healthy need an insurance that is less built up. It's using the idea of cost sharing, that everybody has to pay for everybody else. It's noble, but it's also called socialized medicine.
And it's expensive.
Very.
Thank you, Doc.
Good to see you, Bill.
Marc Siegel, nice to see you, too.